Thanks for staying with us. I'm Akshay Tandon. Monday will mark a major change in Ontario's pandemic protocols. Starting tomorrow, it will be largely up on the people of the province whether or not they want to wear a mask. But many vulnerable populations, especially people who are immunocompromised and those with physical disabilities, are concerned about what this could mean for them. For more on this, I'm now joined by Dr. Andrew Boozary, Executive Director of Social Medicine and Population Health at the University Health Network. Thank you for your time, Dr. Boozary. Appreciate it.
Thanks so much, Akshay.
Let me just start by asking you, masks coming off tomorrow, is it the right time?
Look, I think one, it's important to recognize where we are in the pandemic. It's been, coming up on the 2-year mark. Again, looking back at what everyone has gone through, how many we've lost and the sacrifices that have been made. I think that that's something we have to reflect on. But when we look at the timing in terms of the mandates being lifted tomorrow, it does feel early in the sense of where when we look at what's happening in other jurisdictions, many having to actually return to their mask mandates. And especially when we're thinking about what's going on with respect to the calendar year, where we're at with school, and where we're still at with the weather, with many events across the country still being indoors. And just knowing again about the evidence that we've seen over the last year, especially with respect to masking being able to significantly reduce transmission. And I think, again, when we look at the cost-benefit analysis, it's not a huge amount of imposition on masking, with some real benefits, especially, as you've mentioned, to protect our most vulnerable, which has to remain a priority throughout our response.
Talk to us a little more in detail, Doctor. What is happening in these other jurisdictions right now? Because in some cases, the vaccination rate may be low. In some cases, those jurisdictions may not have seen the surge we saw here in Canada with the Omicron variant in particular. And what do those spikes in cases mean for populations which are most vulnerable, people with physical disabilities or immunocompromised?
Yeah, it's a great question. And it's something, again, that we need to just ensure that we have vigilance around what's happening. I mean, I think that there's still hopes that we, can, avoid a large wave or hopefully see a bit of a smaller wave, given to your point about what's happened with respect to the Omicron wave. Definitely an important piece around the vaccination rates, but it's also important to recognize that we have less than half the population without a third dose. And especially when we're thinking about our elderly who are without a third dose, many still across the country without access to the third dose. So ensuring that we're, using these times of what may seem like a lull, but it really isn't when you think about the fact that we have over 4,000 people, 4,000 Canadians hospitalized with COVID right now. But in these periods is when we have to do the hard work. And so that means, getting the vaccinations out to as many people as we can. And again, ensuring on this layered approach that, where we see a real benefit with masking, that can stay in place until we have a bit more certainty as to what's happening, both outside Canada, but particularly within our own borders.
I want to talk to you about how masking, unfortunately, Doctor, has also become an extremely political situation, where when people wear a mask, it seems as though they are trying to stand for something. But as we know, it reduces the risk of transmission. What will your advice be for people who want to continue wearing the mask versus others who are like, why are you wearing one?
Yeah. But, I would flip that, Akshay. Again, it's so hard. Again, we talked about this at the top about how many people we've lost, how much sacrifice everyone has made throughout the pandemic. And to be seeing this now as, being politicized, I mean, really, I think it's not about putting on a mask to stand for something. I think when you're putting on a mask, you're standing up for taking care of yourself, but also your loved ones and protecting others, especially those who may be immunocompromised or people with disabilities, and definitely folks who are more vulnerable, who've not had the privileges of being able to stay at home over the last 2 years with respect to essential work and people who've been underhoused or without stable housing. So I really, we have to push back and past this politicization, especially when we see the evidence in a variety of settings showing just how effective masking has been.
Right.
And again, really ensuring that if we are going to talk about the solidarity and us taking a collective approach, we need to think differently than sort of saying, well, here's an individualistic approach and, chart your own way. In a public health response in a pandemic, that is almost always assurance for failure.
All right, we leave it at that for this afternoon. Dr. Andrew Boozary, I appreciate your time. Thank you.